You're listening to a brief excerpt from Integrating Risk Management and Patient Safety, co-sponsored by DNV GL Healthcare. During this webinar, officials from DNV GL Healthcare provide a high-level introduction to some principles and tools for aligning risk management with patient safety initiatives.
My name is Tammy Allen, and thank you very much for joining us on this webinar today regarding patient safety and risk assessment. What Renelle and I are going to do today is we really want to start out by sharing a little bit about who we are. We are the leadership team at DNV GL Healthcare and presenting this webinar to you through the lens of an accreditation organization. For those of you who are familiar with the DNV GL model, you will recognize the combination approach to accreditation to include both the CMS COPs as well as the ISO approach to risk-based thinking. The takeaway from today's webinar is the following objectives: to review enterprise risk management and how ERM drives patient safety initiatives, to review tools for assessing patient safety risk, including a focus on risk assessment matrix, and 3, to discuss approaches to prioritizing and implementing proactive strategies in response to patient safety and risk assessment. And now I'm going to turn it over to Renelle.
Thanks very much, Tammy. Good afternoon, everybody. So first of all, we're going to talk a little bit about the evolution of enterprise risk management and really the definition of risk, what risk is. So we know that healthcare risk management has become way more complex than just patient safety. There's some expanding technologies. We see an increase in cyber concerns, and then also the ongoing and ever-changing regulatory changes, some legal issues, political issues, and then reimbursement requirements. So I wanted us to pause for a minute and just go back all the way there, as far as back as we can, to see where did risk management really start. And for those of us that's nurses in the room, I always have to pull up Florence Nightingale, the mother of nursing. And she said that we should all take responsibility for the sick and we should prevent unnecessary suffering and death. Her work became long before today's technology and complexities with risk, and she believed that every decision that we make and every practice that we do really has to do with helping the patient and recognizing that the patient's life is at stake. So in summary, we really can take risk management way back to the 1900s, 1800s, and dealing with the sick and the prevent unnecessary harm.
You've been listening to a brief excerpt from the Integrating Risk Management and Patient Safety webinar presentation. This webinar was co-sponsored by DNV GL Healthcare and recorded on December 10, 2019. The full webinar included an interactive speaker presentation with audience Q&A. You can watch the full webinar video by using the link provided now on your screen.